Alright, how we doing YouTube? Nick Pratap here from Next Gen Rehabilitation, and in today's video we got something special. We actually got a close friend of mine and a physiotherapist. His name is Jayten Patel, and what I decided I wanted to do today was an interview with him on kind of his pathway to becoming a physiotherapist, the pros, the cons, how he's liking it now, and just kind of take it from there. Okay, so Jayten Patel, welcome.
Thanks for having me, Nick.
No problem. So let's just get started off with kind of your background. I know with physiotherapists, some people are coming from a sports background, some people are coming from, left field, they have nothing to do with sports. So tell me a little bit about yourself growing up and how you got interested in physiotherapy.
Right, yeah. So I grew up playing sports kind of my whole life. I played basketball, I played soccer in high school. And yeah, I've always kind of been a fit kind of guy, going to the gym, playing sports. That kind of led me on to go to SFU to do my bachelor's in kinesiology. Really good program out there. Started working with some sports teams there, a lacrosse team, a rugby team as an athletic trainer. So kind of taping ankles on field, just standing field side and then assessing injuries as they come. And then that's kind of what led me towards physio in terms of the whole orthopedic and musculoskeletal injuries, training them, rehabbing them and kind of getting them back to sport and kind of inspired me. Yeah.
No, that's awesome. So would you say your main kind of driving force for getting into physiotherapy was more like you got a personal injury, or you just took a keen interest in working with athletes, or you just loved working with injuries, or all the above, or what would you say?
Yeah. So, playing sports growing up, I did suffer from a few injuries, a lot of ankle sprains. I did tear my MCL as well. And then, just knowing, going to see a physio when I was younger, it was interesting to see how they kind of took the approach of making sure I returned to sport. I had a pretty good physio growing up, and it was interesting to see what they were doing. And then I kind of sparked my attention, saying, "Wow, this is pretty cool stuff." And then, not only did I, rehab from the injuries I had, but also then to continue strengthening and continue learning about injury prevention was really cool. So now doing lots of stuff. There's a lot of evidence now saying that if we do a lot of exercises in terms of prehabbing, you risk your potential of injury later on. So now it's taking those fundamental principles and applying it into sport and to the athletes, to helping them play longer on the field and kind of preventing themselves from injury in the first place. So
awesome. Yeah. No, that's awesome. So we do have a lot of younger listeners, younger meaning they're in high school. I don't know what the heck to do. I'm kind of figuring out what I wanted to do. So if we had to take it back a couple steps to when you were in high school, what kind of courses were you taking, and how'd you decide on kind of what school you were going to go to for your undergrad?
Yeah, so even in high school, I took all my generic sciences, so physics 11, chemistry 11, bio 11, and then even in grade 12 I took the same sciences. So I think taking sciences is really important. It's a good foundation for understanding how the body works. Physics and biology especially, just in terms of human kinetics, mechanics, and then as well as anatomy and physiology. Those are great. It's a good foundation. And then I did kinesiology at SFU just because it was a science-based degree. Sciences could be difficult because it is a lot to study, but again, it set me up for a good foundation for when I got to physio. It gave me the core principles of how the systems worked, how the body works. It's just a platform. So if, for all the young kids in high school, I would recommend, taking your sciences, all three of them if you could, physics, chemistry, and biology. It is challenging, but it does set you up for a good future. And then, when you get into university, it's good to do a science-based degree. So whether kinesiology or human kinetics, physiology, and then that also sets you up for different platforms too. In case it's not just physio, you can open yourself up to different doors in that whole healthcare field.
Perfect, yeah. So going back again, so you were saying you did some courses in terms of sciences to get into the school. I think that's awesome. Would you recommend doing some sort of volunteering, internship, anything like that, either before or during university?
For sure, absolutely. Most kids play sports right now, and the best way, to get involved is actually, once you stop playing your sport, keep in contact with your coaches and shoot them an email saying, hey, I kind of want to go into physio, and that's a cool way to kind of grow into the community, a sport that you're already playing, that you're already interested in, and you have good connections there. Mm-hmm. That's a great way to just get involved, and then there's tons of opportunities out there. You just have to go out and find them, and of course, like getting involved in sports and any even just weekend events would be great to get good experience. Mm-hmm. Kind of tells you what you like, what you don't like. It's just good to kind of experiment with that as well.
Awesome, yeah. So again, transitioning from high school, going into university, what would you say the academic shift was? Academic shift meaning, the level of hours put in studying, how hard the material was. Kind of go into that realm and seeing from your perspective how it was.
Yeah, no, school is challenging, and I wasn't always the brightest kid. I mean, I did struggle the first and second year in university. The sciences again are hard. I think school is, once you get used to it, once you know how to write exams and take exams, you get better at it. You do definitely have to work hard. You have to study a lot. You do need really good grades to get into physio school. And if that's your focus and if that's your passion, then I always say that nothing should stop you. That should be the driving force of really putting in the work and getting to where you need to go. But school is definitely a priority, so everything should be geared towards getting good grades, going to see your TAs and your professors after class, getting extra notes. You got to separate yourself from everyone else because it is competitive. It really is. But again, my thing is, if you're passionate, you know when you want to get into, you're gonna get into physio school.
Definitely. No, that's a great answer. So. Going back, again, athletic background, you had some personal injuries of your own. That's what got you interested into doing physiotherapy. You did your prereqs in high school leading into university, great. You got into university, realized, the schooling's a little bit challenging, but again, you pushed through it, worked with some TAs, got decent grades. And then you came across the next challenge, which is kind of, applying for physio schools, deciding which one you want to go to. Kind of go through that process of how you picked schools, financially how you're going to, secure yourself, and evidently which school you ended up going with.
Yeah. So born and raised in the Tri-Cities. I was only about a 10-minute drive from Simon Fraser University. I selected that school because it was close to home, and I knew that it had one of the best kin programs in Canada. And I'm sure, so Nick also, he did his degree also in kinesiology, and a lot of my other friends and even professors and everyone across Canada could arguably say that SFU has one of the greatest kin programs in Canada. It was one of the first ones that ever started in the Canadian educational system here. So for me, I was, without a doubt, I was going to do kin at SFU. Then when I started, of course, it was challenging, and you meet different friends, you start taking different courses, the electives, and then in terms of my grades and everything, then I started looking at physio schools after the third, fourth year. It took me 5 years to complete my undergraduate degree. And with physio, I was looking at kind of getting into a Canadian school because in terms of tuition, it's a bit cheaper. It is subsidized by the government. I know UBC actually has one of the cheapest tuitions for physio school. So that was kind of my main choice. Also, just staying home, I wouldn't have to my expenses would be nice and low. Of course, UBC is really, really competitive. But in terms of getting in, they look at your last 30 credits, as well as with all the prerequisites. Sometimes it changes, so definitely go online and look at what the content is. But don't feel if you're doing poor your first, second, third year, like myself, that you can't really turn it up on your fourth and fifth year and really crush it, because those are the courses that matter. Those are the courses that are more relevant to the degree that you're going to be doing in physio. So really just push yourself in that last year. And you should be shooting for about a 4.0 GPA. I mean, and as hard as that is, but you definitely have to push yourself and do what you need to do to get there.
Definitely.
And in terms of getting into UBC, luckily I applied for the first time, got in. I think I applied with a 4.1 on the SFU scale. So sometimes scales are based on 4.3, 4.0. But you should be shooting for A+ in every course.
What would you say? I mean, again, it's the higher the better. But is there like a cutoff?
The cutoff, I think, for our class was about a 3.8 GPA. And here's my take on also GPA and your experience levels, because this is a huge conversation a lot of people have. There's a lot of my friends that they deserve to be in physio school without a doubt, and they would be fantastic in their careers. Unfortunately, though, GPA is one of the deciding factors of getting an interview. So there's obviously stages of application as you basically apply with your GPA and then your experience. You need 70 hours of experience working with children with disabilities or specific physiotherapy experience. And that pretty much is kind of, everyone can do that. So in terms of getting the interview, it's based on strictly GPA. Then when you get the interview, they definitely take a look at your interviewing skills. They look closely now at what you were doing before, your background, and then that's when they decide whether, he's appropriate for physio school or not.
Right, okay. So I'm going to get into another question, actually, kind of what you're talking about, but going back a little bit, and I get this a lot actually from a lot of students that are in school right now, talking about, oh, you know what, Nick, I got into school, it's a 4-year degree, I just want to smash it out, get the 4 years done, rather than taking their time and, you know, exploring other avenues, trying different things, you know, going into an internship. What do you think about that mentality of kind of just going there and just getting it done versus taking your time, not being in a rush? What would you say to that?
Yeah, I would definitely take your time. I agree. I don't think it's all about school. It's more about the process. It's more about the teams you're involved in. It's more about the experience you get from your undergraduate degree. Use it as a stepping stone where you need to take. I mean, it took me 5 years. I took summers off. So it wasn't all about school. I definitely enjoyed, you know, traveling during the summers. I definitely enjoyed working with sports teams, getting good exposure. You know, yeah, it's good to take your time. I mean, nowadays everyone says, oh yeah, like, you know, you should know what you want to do at a young age. Things shift, and it's good to know, again, trust your heart, trust your instinct. You're going to know what you want to do, and if it's not physio, that's fine. But again, taking the sciences and knowing, getting yourself involved, it's just trying different things and taking your time. And yeah, I think it's more of a process than, yeah, I got to do school, I got to get in this, I got to do that. Because sometimes the plan won't work out, but then what are your options after?
Yeah. And then the other thing, just to go off that point, everyone watching, is when you are making that decision, you know, what you're trying to do, you know, really sit down and think about it, right? A lot of people are going to tell you different things, mainly your parents, teachers, people that care for you. They're going to try to, you know, say what they think is the best for you, but at the end of the day, kind of what Jayten was saying is, you want to go off of what you really like, right? You want to go off of what your heart's saying, and that's not an easy decision to make. You got to be doing, you know, different things, exploring different avenues. So when you know, 10, 15, 20 years down the road, when you look at yourself, you're in a career that you're like, you know what, when I do this, it doesn't feel like work for me. I feel like I'm showing up and I could do this without getting paid. And that's kind of the goal that we want to be, you know, setting up for ourselves. So when we do go into work, it doesn't feel like work, right? So no, I think that's a great answer. All right, so let's go back to kind of the process again. So finish up SFU, looking at into you know, getting into UBC. One thing I wanted to hit on was the interview process itself. So I mean, physio schools, med schools, they're known for their actual interview process. Could you kind of hit on that and kind of, you know, just a quick overview of how that is, how maybe some students can prepare if they're looking to prepare for that, and how it went for you?
For sure, yeah. So how the interviews work in physio school and even med school, it's called a multiple mini interview, an MMI interview. So it's a different type of style. It's not just like a one-on-one interview, like, why do you want to get into physio school? What are you passionate about? The interview is basically based up in 16 stations, and you have 2 minutes to read the station outside the room. Basically, there's a scenario, you have to read it, understand what the situation is, understand what you need to do in the room when you get in there. And then when the bell rings, you have 8 minutes to go in the station, and basically there's someone that's asking you again questions, and you're basically going over the scenario with them, telling them what you would do. It's all based on context, so I couldn't tell you examples of what they really say, but they vary different topics from, you know, economics, from even just like present situations now. But it is very stressful. You get in there, you have 8 minutes, you have to kind of know what to say. But one thing I'll tell you for sure is definitely speak from your heart. Don't feel like you have to memorize things going to these interviews. If you're yourself in that interview and you feel comfortable with what you're saying, that's definitely what they look for, and they'll be able to see through that too. They're not looking for, you know, a scripted answer. So as much as you want to prepare by reading books, and there are some great books out there that I found off Amazon, and some of my other friends of mine passed me down some good content. As much as you know, you have to prepare for them by reading what to look out for and stuff like that, it is more being, you know, honest and being yourself. More of all of these scenarios are based on ethics. So they just want to know if you're, you know, going to be a good physio. Are you going to be a safe physio? Are you a respectable human? Are you an integral human? They're looking at values, your character, stuff like that. And I mean, that's not one thing you can really fake. I think that's just being yourself, and they're going to be able to separate whether you're appropriate candidate or not.
No, and I think that's a really good answer. So, I mean, a lot of students, a lot of, you know, kids or graduates trying to get into a program, really focus on the studying, really focus on the preparing, right? But they sometimes forget who they are. They get so caught up in that, and I think you hit that really good there. Is really being transparent, really being genuine to who you are. Try not to, you know, because a lot of the questions from kind of what you were telling me aren't like, you know, one answer type questions. They can come from multiple. Some of these don't even have answers, right? Some of them are just super, you know, out there, and they just want to see how you think, how you feel about certain things. So yeah, just like Jayten was saying, be yourself. go out there and just give the answer that you feel is most appropriate, and that would help the most people type of thing, right? And that's the best way to look at that. So no, I think that's great. So after the interview process, obviously you got congratulations on that.
Yeah.
Into the UBC program. So after that, let's kind of go into grad school now. So how does that look? In terms of your classes, is it a quarterly system? What are semesters looking like? How many classes are you doing at a time? And how much time are you actually investing per week or per day into studying?
Yeah. So it's a very intensive program. So all the physio programs in Canada are 2 years long, 24 to 26 months. And it's pretty intense. You don't get a summer break. You do get 4-week breaks in between each semester. So each semester is usually about 4 months. And they go heavy in the biomechanics. They go heavy in the physiology, the anatomy. Then they break down the sciences the first semester. Then the second semester they bring in musculoskeletal injuries. They bring in neuro. They bring in cardiorespiratory material. I would say the content is pretty heavy. You're basically in class 8 hours a day, separated obviously with breaks in between classes, and you get an hour lunch break. But after class, after 4 p.m., you go to the library, you go back home. You got to review all the material you learned that day, and you start all over the next day, and all the exams are all within 1 week. Some people manage to work part-time jobs. I respect that. People have to pay rent, people have expenses to pay. They say that it's not, it's tough. It really is tough to work and do school. Myself, I just focused on school, and it's definitely a grind when you're in grad school, and it is challenging. But it's 2 years, and I know in America they do a 3-year program. If you think about it this way, they condense 3 years into 2 years, and it's a lot of content.
Right, yeah, and then I've heard that, right? So it's kind of what you're preparing for. You don't expect to go in and be kind of a cakewalk, right? Yeah. You're basically took this general scope of kinesiology, and you're really specializing it down to what a physical therapist or physiotherapist does, and their niche is dealing with musculoskeletal injuries, right? And you're still learning, obviously, right?
Yeah.
It's never a process that kind of stops. So no, I think that's awesome. So the other component of that was doing work experience, correct? Mm-hmm. And so how does the work experience fit into that? Is it mandatory? And how'd you go about picking where you decided you wanted to do your work experience?
Yeah, so part of the program, there's 6 clinical placements you have to do, and usually it's based on selection. So you got to choose your top 5 where you want to be set clinically, and the program usually selects that, but you have to do it in different categories. Luckily, I got some of my top choices, and sometimes they're all scattered across the entire BC. At UBC, there's a northern rural core program, and some of them go out up north to do some placements. We have students all abroad, and then they encourage even local students that live in the intercity to go out and do a rural placement as well, to get some good experience. So so there, and the placements you learn a lot on placements for sure. There's so much you can learn by just reading in the textbook, but when you're in front of patients and seeing them, that's kind of where you're learning everything really. Mm-hmm. So
awesome, yeah. So 2-year program, grinded it out, went through everything, and then we get to the end, which is probably the toughest part, is writing the boards, writing your exams, right? Yeah. So kind of take me through that whole process, how studying was, and how you were managing your state, and eventually how it ended up.
So the Canadian schools are meant to help you prepare for this one board exam. Everyone writes it, whether you're an international physio student or you've studied in Canada, you write the exact same exam. UBC has a great curriculum to help you prepare for that exam. I'm pretty sure the passing rate is around 95%. All of us passed the written this year, thankfully, and then we actually just got our results back, and I passed the practical exam, so fully registered physio now. It's great. It is very challenging to study for. It took me about 2-3 months just to study for lots of content. You study all of the musculoskeletal injuries, you study all the cardiorespiratory, you study all the neuro. But once you pass those board exams, you're an official physio, right? So one good thing though is the physio community is so big, you're going to get a lot of resources passed down from you. So when I started physio school, all the grads above me, they gave down all their content. I have a few friends that studied across Canada. You kind of come together and you just study together, and it is about making friends in that network and studying together, going through resources. Of course, you can't just do that on your own, right? So you make study groups, and and you study hard, get the exam done, and then
No, I think that's awesome. Another question that a lot of students, again, grad students, are probably going to have is when it comes to the finances. So when it came to, you know, doing the undergrad and actually doing the grad school, are there other avenues that they can go down if, you know, financially they're strapped or they're in a tough situation? How would you recommend them going about that?
Yeah. So, you know, if you got into grad school and it's hard for you to afford it, you can always take out student loans. There's also scholarships. UBC has their own scholarships just specifically for physio students. You'd have to apply for those. They're based on grades. They're based on your clinical experience, your expertise in the program. But one thing I have to say that UBC actually has the cheapest tuition, I believe, in Canada. It is subsidized by the government. I think I paid $16,000 all in for the 2-year program. And if you look at that, that was cheaper than my undergrad at SFU. So tuition isn't too bad, but of course there's student loans. Again, you can work part-time and basically find your way through that.
No, perfect. Awesome. So yeah, you went through that, did the boards, official physiotherapist now, right?
Yeah.
So he's a working man, everyone out there, right? He's putting in his hours now. And this, you know, a lot of people think that once school's done, oh yeah, I'm in, I got work. But no, it's not like that, because now you're out in the real world, and this is when it actually starts. Okay, now I gotta start putting in work, right? Because it's not like the guy just gets handed clients, everyone, right? He doesn't just show up to a clinic and boom, client after client after client. The guy's gotta he's almost gotta market himself a little bit, but he's gotta build up a reputation, right? So after you finish school, you graded, kind of go through the process with me on finding your first kind of gig or first job that you landed, how that whole process went. And kind of what you're doing right now.
So, you know, just kind of when we were writing the board exams, UBC offered a rehab job fair. So we went to the job fair. There's tons of, you know, vendors there with booths and stuff, with job applications, and you could apply for jobs there. You also had to do your own personal research. The good thing is once, you know, you're a physio, there's actually a lot of jobs out there, whether you want to work in the hospital or you want to work in private practice. There's jobs in both areas, so you get to really choose. Some of my classmates decided to do half part-time public, work in the hospital, and then part-time private. It's really great to just get different exposures. I started working at a private clinic, and now I work in a different part-time clinic as well. So just 2 part-time jobs, and both clinics are very different, so just getting different experience. Again, in terms of landing the job, you do your fair share of research, interview at all these clinics. Don't just decide you know, on a few clinics. Like, it's good to get all the interviews, and you're going to get them, so definitely do your research. And then once you become a physio, Nick's right, you know, you're always learning, really. You have to expose yourself to different things. There's so many courses you can take after, and the best thing to do really is just, you know, first work in general practice maybe, or get some experience, but find what you like. You know, if you see a concussion patient, or if you like working with sports teams, a specific sport, if you like doing the neuro, if you like doing cardiorest, stroke patients, Parkinson's, the possibilities are really endless in physio. The stream is so wide, but you don't need to rush into it. And that's the beauty. You have, once you're a physio, you have your whole career to decide what you want to do. But early on, you're gonna get those. You're gonna feed into what you really like, and then that's when you take courses and stuff. And there's so many people that I see that it's like, whoa, wow, like I don't really know exactly like kind of what to do, but that's when you hit the books and it motivates you more to be like, hey, how am I going to be able to treat this person better because they haven't received, you know, treatment in the past, or, you know, it's a beautiful thing.
Definitely no. So right now working in the clinic, talk to me a little bit about how your workload is, how you're managing that, and kind of the process of building up a clientele. How would you say that's going right now?
Yeah, so in all honesty, private practice is actually pretty tough. You know, everyone thinks that, private practice, you know, you're gonna make a lot of money, it's gonna be great, you know, but it is tough starting off. So as a new grad, you know, you start at a new clinic. Even if you start at a clinic that's reputable and gets a lot of patients in, you're a new physio to that clinic, right? So no one really knows your name, you're starting off. You're basically going to see about 2-3 patients in a week. You know, you're going to have a wide open schedule, and you're going to be, you know, taking breaks in between from seeing clients, because remember, in private practice you only get paid for the patients you see. And it's discouraging sometimes, right? It's frustrating. It's like, oh wow, you know, I did this and now I'm not seeing patients. But you can think of it that way, or you think of it as, well, no one knows me, so how am I going to get my name out there? How am I going to really, you know, make an influence on this community that I'm working in, or what else am I going to do to, you know, get patients in? And kind of like what we're doing right now, like just, interviewing and just meeting lots of people, networking, and obviously being a great physio with the patients you are seeing, but just finding ways to kind of, getting good referrals in the community and stuff like that. But it's really slow. I've only been working for about 5 months, and I would still say I only have a 50% caseload. Each clinic's different. If you're going to start at a new clinic at a smaller city, it's going to be hard because no one really knows that clinic yet, and it's a smaller community. Bigger clinics in Vancouver, sure, you might get busy, but also, they might have 10, 12 therapists working at one clinic. So you're not going to be the only physio there. So you're not just going to get all of the new patients that come in. So those are all interesting things to look at. We can go into more detail in terms of percentage splits and really trying to find the right job that suits you. But it's challenging, but for me, it's also a beautiful thing because it's like the harder I work, you get rewarded by getting patients to get referred in, and
and I think kind of going back to what you were saying before, even the whole process of going through school, right? Like it's competitive. It's not like he's only physio coming out of school, right? There's a lot of physios coming out, so it's really going to be about what's differentiating you from the next person, right? How much extra work are you willing to put in to kind of set you apart from everyone else that's in your field, right? That's what's going to attract more clients to come to you, right? If Sally comes into the clinic, Jayden treats her and he's like, oh, you know what, you helped me with a problem I've been suffering with for 5 years, 10 years, 15, 20 years. Obviously she's going to go out and refer Jayden to her friends, family, and that's just kind of going to be the process, right? So it's not about just coming in, doing a quick adjustment, throwing someone heat pack on someone, doing some ultrasound. No, I mean that's the easy route away to do it, right? You really want to be taking your time, really defining your craft and being able to go out into the community and treat every patient like almost like it was a family member, right? I'm sure you have that same mentality. I know I do. Every time you're treating a patient, you want to make sure that you're giving them the absolute best that you can, and if there's any concerns, if there's any issues, you're going to be going and doing your due diligence to really try to troubleshoot and problem solve for the patient, right? So I think I really commend you on doing that, right? So the next thing I wanted to ask you was the pay scale, because a lot of people are going to be asking about this, right? So going into physio, you came out, certain schools, like you're saying UBC, it's a little bit easier to manage, right? It's not as expensive of a program, but at the end of the day, the students can be coming out with some sort of, debt, right? So they're wondering, how long is it going to take me to pay this debt off? How much am I going to be making per year? So kind of just go through the breakdown with me of, what a physio can expect coming out of school, and then, 5, 10, 15 year outcome in terms of salary or wage that they're going to be making.
For sure, So there's two basically options when you're a physiotherapist. You can either work in the public healthcare system or you can go work in private practice. So in the public healthcare system, you're working usually for hospitals. You're also working for maybe some neuro institutes like GF Strong in Vancouver, and you get paid a salary. I think the starting wages for a new grad is $36 an hour. You get full benefits. That's for your family, your spouse, and your kids. The benefits are fantastic. You get a great pension package. They even offer educational credits. So they want you to take extra courses in either neuro, cardio, resp. You get paid vacation pay. These are all great perks in the public healthcare system. A lot of my classmates that are, females that have families, and now that they're expecting kids and stuff, they've decided to go that route because financially, it does make sense for them. The reason why then I chose private practice, and the reason for that is because, I don't have a family yet, and I also wanted to go into orthopedics and sports and stuff, so you get that population there. And the pay there, you get paid more perhaps for an hourly rate. So let's say if the clinic, I think the average rate in Vancouver, they're charged $90 a session, and that's usually for half an hour. They can be there for a bit more than that, doing their exercise and stuff, but you usually get one-on-one time for half an hour for $90. And then usually, beginning as a new grad, you get 50% of that as a split. So 50% goes to the clinic, 50% basically comes to you. So technically, let's say if you work an hour, you're seeing 2 patients at $90 a pop for half an hour. It's $180, but then 50% of that goes to the clinic. So you're basically making $90 an hour. Now, that's a huge number. You're making $90 an hour. But like I said, right now, your caseload is going to be slow at first. You don't get paid vacation. You don't get any benefits. You're an independent contractor. You have to pay, CPP. Your taxes are a bit higher. There's more expenses. And again, you're all independent, so if you leave, if all your patients go away, you're not secured that whereas again in public you do. So it's a complete difference in pay scale and in terms of benefits and everything. That sure the pay is more, but I think you do have to be willing to put in the work and stuff like that in private as well.
Yeah.
But in terms of salary wise, for public, usually people that start off they make around 75,000 a year, 75,000 a year. That increases slightly over time. Whereas if you work in private practice, I would expect around 60 anywhere to 80,000. The range is so wide because you could be stepping into a busier clinic, or you could start at a new clinic. But then once you're building a caseload, the salary can go up. And I would say if you're working 40 hours a week, you could be making up to 120 to 130,000 a year as a physio. So and in private, the harder you work, the more you get paid. The more you work, the more you get paid. But yeah, so there's so many differences. It's really depends on the route you kind of want to take. And you can always, a lot of people also switch, right? Like they start private, then they go into public, or they start public, they go into private. Sometimes they do a little bit of both. That's also the beauty. You get a lot of flexibility in the whole physio career as a realm, because you can do a lot of stuff. But one of the things I should say is, physio, everyone thinks you're going to make a lot of money in private. Sure, that might be the reality, but it's not as hard it's not as easy as you think.
Oh yeah, no, definitely. And this is actually going to go right into my next question. So a lot of grads coming out of school just think, boom, I'm out, I got my skills, I'm going to go ahead and open my own clinic now. Right? You hear it all the time.
Yeah.
And we personally, where we live in the Lower Mainland, I swear I see a new clinic open every couple of weeks, at least one a month, right?
Yeah.
So they're out there. There's a ton of them out there, right? So I know right now you're working privately in a clinic, but talk to me a little bit about the person that does have that mindset about, potentially opening a clinic, like coming right out of school versus, waiting a little bit, and some of the challenges they may face opening a clinic.
Yeah, for sure. So if you have like the entrepreneurial background, and if you want to open a clinic, that's great. But what are the skills to back that? If you just became a physio, first of all, you probably don't have any experience as a physio, so do you want to become a good physio first? And I would recommend, getting a little bit of experience just becoming a physio. The business is that's a whole separate component. Just because you're a good physio doesn't mean you're going to run a great clinic, right? So Nick's absolutely right. You want to be working at a clinic to understand the business behind a private practice, and the only way to do that is actually get experience. So I would recommend at least 3-4 years of experience as a physio and working in private practice. Once you grow close to your clinic owner, you can be asking them questions about how does billing work, how does accounting work, all of these things. You can also figure that all out on your own as well. And my biggest thing too is if you're going to open a clinic, what's going to separate your clinic from everyone else? It's easy to open up a generic practice, but if you want to be a really good clinic, what's really going to separate you? And a lot of people now are doing they're specializing in concussions now. They're just strictly opening up sports clinics. Now there's a lot of neuro clinics. So it's really what's going to separate you. But again, that experience has to be there first before you open something yourself. So that shouldn't be the goal. I think once you become a physio, your main goal should be you be like, okay, well, I'm a new grad. You're an entry level physio. That's pretty much really all you are. But I want to become a great physio first, and spend 2, 3, 4, 5 years, however long that takes, to first understand the role of a good physio. And then you can think about opening up a clinic. Not to say that those ideas should just wait 5 years. You can slowly build up those ideas, but just going right out of school and opening up something like that is,
Yeah, no, I totally agree, right? And just kind of what Jayten's saying there. I mean, if you look at any profession, any craft, any of the greats that are doing it out there, they didn't do it overnight, right? It didn't take them 1-2 years. A lot of them were doing it 5, 10, 15 years. They got the absolute best at what they were doing. And then they started getting such a big caseload, clientele, patients, whatever it may be, that, they figured maybe me branching off and taking some of my creativity to expand my ideas and thoughts might be the best stage or best thing to do at this point in my life. But yeah, like Jayten was saying, when you're first coming out of school, at least minimum first 5 years, I'd say, really focus on building your craft, studying still, and really refining your technique, right? Because that's what's going to excel you ahead of a lot of the people that are in the market as well. So a couple of questions here, and then we'll wind this one down. Kind of talk to me now about once you finish school, because a lot of people think once you finish school, education stops, so you stop learning, or you don't need to really refine it. But obviously, we know in at least the field we're in, we have a lot of continuing education credits we got to do, that sort of thing. So talk to me a little bit about how you go about choosing your continuing education, why you think it's important, and for someone out there saying, "Oh, I don't need education," what you might say to convince them a little bit.
Yeah. I mean, it really never stops. There's always new research coming out on a day-to-day basis. There's always new stuff coming out, and also even with the old stuff, sometimes our minds are geared to remember everything, right? Like you have to be able to review stuff that you want to, and this is the whole thing where you constantly need to reflect on your practice. You constantly need to review stuff that you forgot, because sometime in your career you might come across it again, and it's like, oh, I need to review this. And in terms of staying with current times, I think you really do need to read the research and change your practice, because the world's going to keep spinning, but if you're not spinning with the world, then you're going to be left behind. And we call them dinosaur physios now, that are basically doing the stuff that they were doing 20, 30 years ago, and they're doing the same thing now. But all these young guys that are coming up who are like, well, all this new research says that this is what we should be doing. So, but again, that's going to change in even 2-3 years, and then what's the new stuff? And you're always going to have to be keeping reading. But I think it's an amazing thing, because you got to keep learning. I think, and that's I'm passionate about that, because it's, why wouldn't you want to learn all the new stuff? I mean, there's so much to know, and I think you can never just settle with, I'm comfortable where I am right now, and there's a lot to know, and I don't think it ever stops, which makes physio such a great career, because it'll always spark your mind. It'll always keep you active. Nothing will ever be mundane, or you never be tired or bored. And as soon as you do, that's when if you want to go in a different field, you're more than welcome to, and there's different courses to take. It's all based on what you want to do as well. Don't feel like you're pressured to do things like, this person did this course, or I'm seeing a lot of these kind of patients, but I don't really like working with that patient. You're not pressured to do anything. Take your time, be slow, but never stop learning. I mean, that's the best thing for every student, not even just physio, but everyone can never stop learning, continue to grow.
No, I think I couldn't have said it any better. So last question here, and this is actually more of a personal question to you, kind of looking ahead for you. I mean, you new grad and whatnot, you recently started working, right? Where do you see yourself kind of in the next, looking at 10, maybe 20 years? What are you hoping to be? Who are you hoping to work with? And evidently, what are your kind of goals that you're looking at setting for yourself?
So my, a 5-year plan for me is just to become a good physio. I've recently gotten working with concussion patients now. I really want to focus on that, because there's a lot of good research there, and just being kind of a specialist in that, getting lots of good background experience with working with athletes. And then 5-10 years, I'm 26 years old right now. I'm looking to have a family, being able to manage my practice and raising a family at that time. And then my ultimate dream is to open up a sports performance center, more geared towards for youth. Everyone always asks me, you want to work for the Canucks? Do you want to work for this professional sports team? And that sure does seem maybe like the dream, but I do really like working with the young kids. And I think if you built a sports performance center where you grew them up athletically and told them and taught them the skills of injuries, where they can now self-manage when they become adults, that's the beautiful thing. So I mean, that would be the ultimate goal. Whether I decide to do that individually or find a partner, I have, again, logistics wise, that's not there. But in terms of the vision, I think a sports performance center geared just for youth would be pretty fantastic. Yeah.
Awesome. And last question, from a viewer standpoint, young person, young individual looking at this, kind of not knowing what they want to do, but they like working with sports, they like doing things with athletes, they have a passion for going to the gym, athletics, but they don't know kind of where to start. What would you say directly to that person right now?
Yeah, I mean, the thing is, if you are super passionate about something and you know what you want to do, nowadays I think there's so much content online, so really knowing how to do something, I don't think that's a good excuse. Really, you can go online, find out how to do it. It's really knowing why you want to do something, and knowing really why you want to become this and why you want to do that. That's what really drives you to first initially become that. Again, all the resources are really out there. You can talk to anyone. You got some good content today. Again, you can go online, ask friends, ask peers. But my biggest thing is that if you don't know where to start, it just starts with that one idea. And if your idea is to become a physio, if your idea is to work with athletes, if your idea, is to even just become a personal trainer or really anything, let that idea fuel you and let it, spark basically your career and your growth and everything. Yeah.
Awesome. Couldn't have said it any better. All right, everyone, that was an awesome interview with Jayten Patel today. I'm hoping that you got a lot of good information out of that. I've known Jayten personally for many years now, and you wouldn't know half of the amount of work this guy puts in. Really hard-working guy. I mean, the countless hours of studying, hitting the books, the countless hours of working with mentors over the years. It's one of those things that you'll never truly know, and this is kind of definitely an example of one of the most hard-working guys I think I've met in this industry, right? So one more time, Jayten, I want to say thank you.
Thanks, Nick.
Thank you for having me, or thank you for being on this interview. Where would they be able to find you if they wanted to get in touch, or personal information, that sort of thing?
Yeah, I mean, I have Instagram as well, Jayten P. You can also email me, jaydenp@advancedhealthandwellness.com. Yeah, I mean, I can maybe give a little link or something like that below.
Yeah, we'll definitely put his links, Instagram and his email in the description box below. And if you guys enjoyed this video, please give it a thumbs up, share with anyone that you feel would really benefit from this. And in the comment section, just drop another comment on what other videos you'd want to see. Who else would you want to see? Either myself, Jayten, being on here, interviewing and getting a little bit more insight into their profession. All right. So one more time, Jayten, thank you very much again for this interview.
Thanks,
and we'll see everyone else in the next video. Take care.